Just confirm if y'all can see my screen, okay?
Meeting is being recorded. Hi, everyone. Welcome. We're just going to give our audience a few moments to get situated. Thank you so much for taking the time this afternoon to learn a little bit about medication management, medication safety. We were really thrilled to see the level of interest in this topic and the mix of both residents and supportive team members who were registering to join us. So just give everyone another moment or two. And perhaps while people are logging in, I'll just take a moment to introduce myself. Hopefully I'm a familiar face to many of you joining. My name is Melissa McVie. I'm the Director of Communications with the Ontario Association of Residents Councils, OARC for short. And this is an official welcome to Webinar Wednesday. OARC hosts special guests for a webinar on the third Wednesday of every month. And today, our topic is building a culture of safety through resident and family engagement. And we are so thrilled to be welcoming a very esteemed and diverse panel of guests. First, we've got the many team members from the Institute for Safe Medication Practices Canada, ISMP Canada for short. And so they have a bit of a presentation for us today and will be available to answer some of our audience questions. We also know residents have told us, they've told OARC that it's important and it's something they want to be involved in all aspects of their home operations. And of course, this extends to include pharmacy services and medication management practices in the home and quality improvements connected to that. So that is where we're going to be focusing our time today. And really our experts are those with lived experience. So we have invited two OARC resident leaders, Leslie Froats and Devorah Greenspan, to join our panel to infuse their experiences and their advice for those participating today. So, but before we dig into our subject matter, I'd like to begin our time together with an acknowledgement of the Indigenous people of all the lands that we are on today, from wherever we are virtually participating in today's meeting. Let us take a moment to acknowledge the importance of the land we each call home. We do this to affirm our commitment and responsibility to improving relationships between nations and to improving our own understanding of local Indigenous peoples and their cultures. We acknowledge the ancestral and the unceded territory of all the Inuit, Métis, and First Nation people who call this nation home. Let us now join in a moment of reflection to acknowledge the harms and mistakes of the past, as well as ongoing challenges, and to consider how each of us in our own way can move forward in a spirit of reconciliation and collaboration. Thank you. So before we get started, we do like to just review some of the meeting or the Zoom webinar logistics and housekeeping announcements right off the top, so we can jump in and enjoy our time together. You'll notice that we have disabled the chat box feature, and we've done that with intention. We really want to direct you to put any questions or comments in the question and answer, using the question and answer feature on your toolbar, and that way we can make sure that we don't miss anything in the chat. And I just want to assure everyone this session is being recorded. We will circulate the recording to all registrants following today's session. So if there's someone else in your home who you think might benefit from today's learnings, we encourage you to share this information broadly. We'll also circulate the slide deck and any pertinent links and resources that we speak to today. I mentioned the question and answer box. We really welcome your questions and comments, so please take advantage and utilize that. So we will endeavor to We've protected time at the end of our webinar to get through those questions as best we can. And we know we have different representatives from ISMP Canada, team members, people with pharmacy backgrounds. So hopefully we'll be able to speak to what you're interested in learning more about. And lastly, we do have an evaluation that we really encourage you to take a few moments following today's presentation to share any of your learnings, your key takeaways and suggestions for improvement. And we look forward to incorporating those for our future offerings. So at this time, I'd like to hand things over to the ISMP Canada team to start our time together. And welcome to Melissa Sheldrick. If you'd like to maybe just introduce yourself and share your role, we look forward to getting to know all the members on the panel today. Thank you and welcome.
Thank you so much. From one Melissa to the next. Hi, everybody. Such a pleasure to be able to be here with you today. Christina, if we could go to the next slide, please. We want to just give you a brief overview of what this next hour is going to look like as time ticks by so quickly. But first, I'll tell you, my name is Melissa Sheldrick. My role at ISMP Canada is Patient and Family Advisor. So I connect with consumers and I work on project that needs that lived experience and that general public perspective. And so I have had the privilege of being the faculty lead in our Strengthening Medication Safety in Long-Term Care initiative over the past few years as resident and family engagement. And so I have had the opportunity to connect with Devora and Les over the past few years and to be able to co-develop resources with the homes to support increased resident and family engagement in medication management. And I'll be sharing some of those with you a little bit later on. You will get some more information about the initiative and you'll hear about some of the phases that our initiative has gone through and how we're in the Innovator phase at the moment. So we do have some resources to share and our team is really looking forward to the Q&A session when we can take your questions and hopefully give you some valuable information that you can take back and use for yourself and with your family, but also to share with your resident councils at your individual homes. So like I said, we're really pleased to be here today. And one of the things I want to just start with is a reflection for our resident and family members who are on the call. I wonder how many of you know what your medications are and perhaps what they're used for. Do you feel as though you're kept informed of your medications and their changes? We're going to share different information today about why it's important that you know about your medications and how you can become more involved in that system of management in your home. You play a very important role in your own medication safety, and we want to be able to show you how to do that. And I can think of no other way to really share that, but to introduce you to, and maybe they don't need introduction, but to Devora and Les. And we'll start with Devora. She is a leader in her resident council in OARC. And she has been supporting our work at ISMP Canada over a number of years. She's contributed to a video that we have that we use all the time. And Devora is a real champion for medication safety. And Devora, I wondered if you would share how you have been able in the past to use your voice to protect yourself and to work and collaborate with staff to ensure that medication safety has been a priority for yourself, but also for the residents in your home.
Okay, well, I guess I should start by telling you my story about how when there was a substitute nurse and who gave me medication, and when I looked at it, I'm lucky enough to be able to do that, I realized that that's not my medication at all. I said, no, I'm not taking that. That's not mine. Oh, yes, it is. And we have a system, I don't know, I guess most homes have it, where the nurse on her cart has a iPad or small TV that brings up the resident's picture and the medication they take. And I said to this lady, I want to see that. And she said, no, it's okay. I said, no, it's not, you know. As I got older, I get pushier. And I said to her, you're not giving me that. It's wrong. No, it's not wrong. I said, well, I'd like to see it on the computer. Well, she finally gave in and put it on the computer, and sure enough, she was slightly embarrassed and upset because it was the wrong medication. And I don't know how to do this. Maybe some of you have some ideas, but there are so many people in long-term care. The residents have changed, and there are many more with dementia or some cognitive impairment who can't speak for themselves. So other than going around with the nurse, which I wouldn't be allowed to do, to look anyway because it's confidential. So I don't know if anybody has an idea or a suggestion as to how you can combat that. Les?
Thanks for sharing that, Devorah. We can't see you. We've got a beautiful headshot of you on the screen, but we can't, I'm not sure if you've got something in front of your camera or if maybe if your background is blurred, but that's okay. The audience can see what you look like, and we'll work to try to get your screen.
I have a lot of wrinkles, that's for sure.
You brought up a lot of really important points, Devorah, about the nature of change in long-term care. And we see that there's changes in residents, and residents can sometimes move around in the home, and there are staff members that turn over, and that's the reality that homes face. And so that's why it's so important to hear all of these different perspectives, to create safer systems, to keep residents safe. And there's so many different parts of that when we think about our prescribers and our pharmacy teams and our nurses and our residents and family members and facilities and all of these different cogs in the wheel that have to align to ensure that residents, whether or not they are cognitively able to identify medications, to ensure that everybody is being safe with their medications. And so that is the work that we have undertaken to support homes in their entirety to strengthen those medication safety systems, because you're absolutely right that there are concerns when there are residents who are not able to identify their medications and know what they are taking. So thank you so much for that. And thank you for the advocacy that you continue to do. And Les has been part of our team for some time. He was involved in quality improvement work with one of our champion homes, and our champion homes were the first 10 homes when we started working with long-term care homes in Ontario. And he was part of the quality improvement program with a multidisciplinary team. And I'm going to turn it over to you, Les, to maybe tell us a little bit about that work, your role in that work, and why was it important that you were such an integral part of that team?
Well, it was very important for me to get involved in that because I wanted to know how they give the patients their pills make sure that they do the right ones. So it was important for me to get involved in that. And when I got involved in it, it was so nice to know that they do the special work to make sure we don't make a mess over the pills. They perfectly make sure that everybody gets the right pills, and they got them so there's pictures on each section, pictures, and that's how they figure that out. And there's always the same person on. I will say that for the home, they make sure that the same person is on and can give you the pills. So I think that's very important to me. To me, it's important. And when I went to the meeting and we did the wall thing where the medicine started and where it started, where it ended, I was shocked. I didn't realize it was that much of an order, of standard that had to be done in order to do it. And Monique Patterson was a big part of that. She spoke up and she did the wall thing, and she did a lot. So I do appreciate her quite a bit.
Les, if
So
I could
thank you.
Thank you, Les. I just wanted to also just jump in and acknowledge that not only were you learning as a resident, and as you've shared, like from the time the doctor orders the medication for how it's handled and
Yep.
every step of the way, I've always been so impressed with your ability to answer your fellow resident questions, and you've shared your learnings with the resident council, the other residents who might have questions or concerns. So you've really become kind of an ambassador to share that knowledge. So I don't want to speak for you, but I think you found the process to be very informative and empowering to be part of that clinical process that residents may be removed from.
I'm very happy to be part of it. I have learned a lot. I have learned a lot about how the pills go and stuff. And it's quite an imagination thing to do. And I'm quite proud to be a part of it. I'm quite proud to be a part of this group too. And it's a great opportunity for me. I've learned a lot. I'm learning a lot all the time. So thank you so much for having me today.
Thanks, Les. So yeah, outside of Les and Devorah's work that Melissa's mentioned, they're also part of an advisory group that comes together several times throughout the year. Again, bringing resident experiences to those interdisciplinary conversations that are happening to really improve the resident experience of medication management in homes across Ontario. So thank you both.
Thank you. If we can go to the next screen, please. Okay, I'll turn it over to Carolyn.
Thank you, Melissa Sheldrick, our patient and family advisor at ISMP Canada. Thank you, Melissa McVie, for the invite from OARC to be here today with this special group and talking about what we're passionate about together. And a big special thanks to Les and Devorah for your participation, engagement, your voice, your lessons learned over the past few years. It has been an essential part of this initiative of our work, and we just couldn't do it without you. And so a big thank you to you. And what you're showing today, what you're sharing today, is you have a passion for medications, but you also have a passion for medication safety. So you have a passion for knowing your own medications, for knowing, important personal things. You have a passion for getting medications safely yourself, and you have a passion for your residents around you to be safely getting medications. Mm-hmm. And we know that there are other residents out there that also share those passions. And we think it is absolutely essential that anyone that wants to engage in safe medication therapy, safe medications in a home should be able to do that. And today we're going to talk a little bit about some ways to do that and answer as many questions as we can. So, Carolyn Hoffman, I'm CEO for ISMP Canada, and I lead the team that implements and evaluates the Strengthening Medication Safety and Long-Term Care Initiative in Ontario. And so I have the pleasure of meeting with all these people, designing how we're going to support and collaborate, and then evaluating that. We wanted to share just a little bit with you about the organization so you know who you're talking to. You are talking to a group of individuals that work at an institute that is focused on strengthening medication safety through timely learning, sharing, and acting to improve healthcare. And we are a national independent not-for-profit based in the Toronto area that purposely partners. So we don't just hope that our information gets into the right hands. We purposely partner with whoever wants to, individuals, organizations, consumers, residents, family members, caregivers, to try and make medications safer in any healthcare setting. And we're going to focus today on long-term care, but we also cross all areas. And I'll get Christina just to advance once, and we'll look at our cycle of learning, sharing, and acting. And I'll begin with learning. So how do we learn? Well, we learn at ISMP Canada by getting reports of when something went wrong with a medication or it almost went wrong and people are worried about it happening and they share it with us. And so those are reports. We call them medication incident reports. And they come into ISMP Canada in many different ways. But what I want to leave today as one of the ways that you can engage in medication safety is anyone can go to medair.ca, the website. So any of the residents, any of your family, anyone can go to medair.ca when an incident happens and share it with us. We use that information and much more to know what's going wrong in long-term care. And with that learning, we then develop recommendations, tools, resources, coaching, facilitation to bring evidence or to bring best practices to any sector, and in this case, long-term care. And we also share to consumers. So the next way you can engage in our wheel and our cycle here is you can go to safemedicationuse.ca. That's our consumer website. And with the learning that we get from residents, family, patients, other consumers, we develop very short one-page newsletters, we call them, on a particular issue and give advice. But we don't stop there with learning and sharing. We actually move to partner and meaningfully, purposefully engage on making those recommendations come to life, on making them happen in organizations. And so the final example I want to share with you today is you do have the opportunity in your homes, and Les and Devorah know about it. So does Melissa and maybe a few others on the call today. But for those that are new in Ontario, any home can join our initiative. And we're going to tell you a little bit more about that later. So that's a little bit about ISMP Canada, a little bit of way about our work and how you can engage. And I want to now move to the initiative. So to make sure you understand and are able to ask us questions about anything you want to do with medications, but in particular, our Strengthening Medication Safety and Long-Term Care initiative, we did want to make sure you knew about that. And so the Ministry of Long-Term Care in Ontario funds us to do this work. And on the next slide, you'll see that we have a faculty that is, and some of them are on today, and crossing disciplines, crossing specialty areas, all types of individuals on our faculty. And here you see myself as a registered nurse. We have Dr. Mike Hamilton that's on today. We have Melissa, who you've met already. Alice, what? Alice is on the call today. She's a pharmacist, and she is a high expert in many areas of medications. Rajiv is not able to be with us today, but is another pharmacist that works on the team. And we have two quality improvement consultants, Ali and Anurag. Christina, you'll meet shortly. She's a registered nurse, and she is also our project manager for the initiative, and very important member of keeping things in keeping things moving forward. But she is also working directly with a set of homes to advance changes to make a difference positively in medication safety. And then finally, we wanted to introduce you to Dr. Andrea Moser. Dr. Andrea is another medical advisor and does work with the City of Toronto in long-term care. So that's our faculty. We cross lots of different areas. Why? Because that's what needs to happen for medication safety to be safe, to be done efficiently, effectively, and safely. So on the next slide, we bring that expertise to the initiative. And we have an overarching goal of using education and coaching to help long-term care homes in Ontario, and it can be any home in Ontario, to respond effectively to medication incidents. So getting back to what I talked about earlier, that's errors in a resident's medication or issues that almost cause an error in medications being given to the residents. And what we know from our work is that many homes don't take the time to take the report in, analyze it, using a methodology that is very strong, very helpful for finding out why things went wrong, and then using a methodology to develop really strong positive changes based on what we know will work for medication safety. So that's our first kind of sub goal. Our second is to help homes manage medication effectively, especially insulin and other high alert medications. And part of this is how they store it. So we're making sure that insulin that can be very harmful when errors happen and other high alert medications have proper procedures, policies, have proper safeguards, and one of those is how they're stored and retrieved and etc. dispensed. And then finally, our third sub-goal for the initiative is to ensure that transitions in care are safe from a med management perspective. One of the most riskiest times for errors is on transition. The transition would be when the resident comes to the home for the first time, is received to the home, coming in. That's a transition. They've come from a hospital or they've come from the community, from their house. And that's a risky time because mistakes often happen with, oh, what were you taking? What do you need to take? What should you take now? What kind of things are important to have that you may not have thought about before, all happening. But sometimes residents have to go to hospital for assessment in the emergency department or for admission, for procedure. And when they come back to the home, another risky time. And we have ways to reduce that risk. And we're working with homes to do that. So on the next slide, you see what's our ultimate objective here? Why are we doing all this work? Well, even if errors only happen a small percent of the time, there are so many medications being dispensed and delivered to residents that harm is possible. And we want to work to reduce the risk of adverse outcomes or harm to residents. And sadly, one of the things that is happening now, not only in Ontario, but across Canada, is medication errors and harm and preventable harm to residents. So our ultimate goal is that. And on the next slide, you'll see as we move into a little bit more about the goals, that the Innovator Home Program is one of the ways they're going to be able to do this. And over to Christina, project manager.
Thank you, Carolyn. It is my pleasure to be here. Just Carolyn shared earlier, yes, my name is Christina Zhang. I'm a registered nurse and I'm project manager at ISMP Canada for strengthening medication safety in long-term care. So before I joined the ISMP Canada, I worked at long-term care over 10 years as a charge nurse, assistant director of care, and director of care, overseeing the medication management program at home. So I'm really pleased to share about our Innovator Home program. So we launched the first intake of the Innovator Home program on May 8th. So Innovator Homes are working now to improve medication safety for their residents and families. The next slide, this slide shows some of the quality improvement project goals that our Innovator Home is currently implementing. So appropriate use of antipsychotics. So antipsychotic medications are the medication that can reduce or relieve symptoms of psychosis, such as delusions and hallucinations. And because this type of medication have a lot of side effects, they have to be managed really carefully. And another quality improvement project that homes are working is improving medication reconciliation process. And medication reconciliation is a formal process in which healthcare providers work together with the residents, families, and care providers to ensure a correct and comprehensive medication information is communicated consistently across transitions of care. Another QI project is improving residents and family engagement in medication management, which is very important. And reduce distraction during medication administrations, improving medication order processing and administrations, and medication incident reporting and learning. We have provincial sharing and learning webinar coming up on October 23rd. At this webinar, our Innovator Homes will be there to share their medication safety journey and share in details about their quality improvement project goals. So please register here and join for the webinars on October 23rd. And the next slide, based on the success of the first intake of the Innovator Home program, so we are inviting homes to join for the second intake starting the November the 6th. So please talk to your director of care or assistant director of care about becoming an Innovator Home and share your voices and to register by the November the 5th. And the next slide, I will pass over to Melissa.
Thanks, Christina. So when we started the webinar today, I asked you to reflect on a couple of questions about your knowledge of your medications. And these questions were taken from a survey that our faculty created a number of years ago when we started the initiative. And the purpose of the survey is for staff to learn how residents and families feel about their medication management and what they know. So our faculty worked with a home called People Care Hilltop Manor for about a year. They were one of our champion homes, like Les's home was. And we wanted to help them identify areas of improvement in their home. So they studied their home's assessments and their needs, and the team set a goal then to increase resident and family engagement in their medication management. And so they undertook a number of activities in their quality improvement plan. And one of them was to take the resident and family engagement survey that the ISMP Canada team had created, and they added to it to learn even more from their residents and families. So they surveyed their residents and families, and they discovered that overall residents and families felt supported by staff in their medication management. They tested out some changes, such as making more phone calls to families to talk about resident medications. They spent more time teaching about medications, and they increased support levels during transition times and medication reviews. So they did that over a course of several months. And when they redid the survey, they learned that there was a higher level of engagement and understanding about medication management than what had occurred in the home in the past. So it was really interesting for them to use the survey before implementing their changes and then after to see how their activities contributed to better engagement about medication management. So the next slide, please, Christina. We've created a number of resources for residents and families, and they're all on our website under the resident and family engagement link, which is there, and we'll be able to share all these links with you after. On the next slide, Christina. So one of the resources that I wanted to share with you today is a video that's on our website, and it talks about the importance of your voice and your role in your medication safety. It will teach you about why it's important that you take that role, making decisions about your medications, knowing what they are, asking questions, all of those good things, and how you can be a part of that safety journey. There's also a handout that is connected to the video that you can download or you can print out that really highlights the key point of the video. So I would encourage you to watch the video with your family members or your caregivers to learn more, and keep that handout handy so you can refer to it if you need to. On the next slide, unfortunately, despite our best efforts and practices, medication errors do happen sometimes. And so I wonder, and, just reflect on this. Has anyone experienced an error? We heard from Devora about how she almost experienced an error. Maybe you got the wrong dose of a medication, or you got someone else's. So there are steps that you can expect staff to take after such an incident occurs. First, staff needs to make sure that you're okay and that they respond with treatment if needed. And then they should tell you that an error occurred and apologize. Next, they will investigate how it happened and share that information. And finally, they should seek your ideas about how to prevent it in the future. You hold a very important perspective that is needed for quality improvement and care. And so this resource is also available for download on our website as well. The next task that we undertook, this is very recent. We just did this earlier this year. We translated many of our resources into 15 different languages. And these languages are some of the most commonly used in Ontario. And we felt that it was important for residents and families to have access to this information so they could fully understand the information that we are presenting on our website. And so to find the translations, Christina, if you could go to the next slide, please. You'll go to our resident and family engagement page on our website and scroll all the way down. And when you see the box titled language on the left-hand side, you just click on that drop-down menu. And there's a list of those languages there in alphabetical order. You can click on the one that you need, and the website and all of the available resources will be displayed in that language. So we live in a very multicultural province, and so it's so important for us to be able to have this medication safety information available to as many residents as we can. Next slide, please. So every year, Canadian Patient Safety Week is held during the last week of October. It's coming up in a couple of weeks. And it is a series of events that are led by Healthcare Excellence Canada. And Healthcare Excellence Canada is a pan-Canadian organization dedicated to ensuring that we all get safe and reliable healthcare in Canada. And this year, the theme for Canadian Patient Safety Weeks is broadening our understanding of harm. Many people face harmful experiences in healthcare and with medications, and it causes a lasting impact in their life. And HEC says that they're learning that people can experience not just physical harm, but psychological harm and social harm and spiritual harm when they're delivering or receiving healthcare. And the work that they're doing is really championing safer care. Medication errors are preventable. They can cause various forms of harms to residents and to their families as well. And so I would encourage you to sign up for the webinars that they have planned during that last week of October. And I will put the link in the chat box in just a moment for you. But they will have a number of different webinars available that you can participate in. And in the link that I'll post, they have a number of different resources that you can use even in your home. They have a great activity card process that you can undertake with members in your home. So I would encourage you to check that out and participate as you can during that week. And so with that, we have some time for question and answers. Melissa McVie, I will turn it over to you. If there's any other further comments that you wanted to make, or if you wanted to address the questions.
And Christina can take down the slides, please.
Sure. I just wanted to say thank you so much to our presenters that have shared so far, bringing attention to the existence of these co-created resources that are available for residents and families. And we'll be sure to link those PDF or the web links to direct people back to your website and to access those tools when we send out the recording of today's session along with the slides. So just wanted people to know that that's coming. Really, I think this would be, we're happy to open up the floor for any audience questions. I think there's just been a few points of clarification that came through the question and answer so far about reminding people what the acronym stands for: ISMP Canada, Institute for Safe Medication Practices Canada. And how long has ISMP Canada been around? And that's 24 years. So thank you for Anne for asking those questions. I'm sure that was on everyone's mind. And medication, I know, is something that residents are curious about, but maybe it's not a topic that has made it onto your resident council discussions or through your agenda. But I just was wondering if Les or Devorah have any thoughts moving forward about how you might keep this topic top of mind, or maybe have some conversation starters with your peers to kind of welcome this kind of conversation, to normalize kind of asking questions, building relationships with the clinical team members in your home, so it's not such a scary thing to speak up when you feel something is off. Or any thoughts? Or
Yeah, well, I make it a habit of telling people, getting them involved. Like we have a meeting. I'll say to them, "Come on in." It's quite interesting to see where you stand, and I invite them to come into the meeting. And a lot of them are scared too. They don't want to know what's going on with their pills, but they need to know what's going on with their pills. They need to be able to say, "Okay, I've had these. What's the orange one? I've never had the orange one before." That's happened to me. They brought me my pills, and there's been an orange pill there that I never get, and so I give it back to them. I tell them I don't get that pill, and that's the big thing. You got to be able to be able to stand up and say, no, it's not what I'm supposed to get. Thank
Sorry.
you.
So perhaps Alice and Michael on the line, maybe you could share a bit the role of how the pharmacy works with the home and the pharmacy consultant. Like, how can residents, aside from asking their nurse or their doctor, how can they get to know the medications?
I'll let Mike answer after this, but I believe that medication reviews are a great way to be involved. It happens, I think, quarterly, or is it every 3 months, Mike, where you can sit down with your healthcare team along with family members or care members of your team, and they can explain each of the medicines to you and what they're for, and provide you with a written list of the medications and what they're for. That way, it's even better if they have a picture of the pills too, then you can also identify them when they bring them to you. We recently did a medication analysis of a group of medication errors reported to ISMP Canada, and the identification of residents was one of the themes that we found. That was not easy for the staff to always be able to identify correctly like the resident, even with the picture on the MAR, sometimes it's not up to date. So that's some of the challenges they face when giving medicine. So I think it's very good, Devorah and Les, you both mentioned that sometimes if you see a pill that you don't recognize, you can speak up. I'll let Mike speak.
Yeah, I would 100% endorse what Alice said. Like every 3 months, your doctor has to go and re-prescribe all the medicines that you're taking. Sometimes it happens kind of without you knowing about it, but certainly ask to be a part of that and ask if you still need all these medicines. Because as you get older, as you get younger, you may not need so many, or you may not need them at a different dose, or you may say, well, I don't want to take this one anymore. I have such trouble swallowing it. Is there something else I can take? So there's lots of opportunity, I think, to get involved. And it's partly up to, people like me, and Alice, like prescribers and nurses and pharmacists to really realize that and go ask our residents, go ask family members, like come and sit with me and we'll go over all these medicines. But if you can, certainly tell the nurse, tell your doctor, I want to be part of the next time you prescribe my medicines so that I can go over this and we can go over some blood work. Maybe that's been done. We can talk about my health and what, maybe I can change some things. Maybe I'm happy the way things are, but certainly be part of that. And as Les and Devorah outlined earlier, it's a very complicated system that gets medicines from the pharmacy into you, really. And it's a lot of people involved, and there's lots of opportunity for things to go wrong. Thankfully, most of the time it goes right. We do get the things that we're supposed to get. We do get the things that we need, but we have to make sure that the whole system works. And remember that you as a resident or as a family member are probably one of the last opportunities you have to stop an error from happening, to make sure things go correctly. So Devorah and Les are right on when they say that you should, if you can, take an active role in protecting yourself against harm.
Well, I didn't know that you could have a meeting every 3 months with your doctor about your medication.
Well, every 3 months they have to re-prescribe it.
I didn't know that.
So it's a good opportunity. There may be some times where there's no changes to be made. There may be some times where, I'm fine the way I am, and that's great. But if you want, you may get bored every 3 months because sometimes it is a lot of the same thing. But there is an opportunity if you're thinking about making changes, or if you're curious as to why you're on some of these medicines, to say, Doc, I want to talk to you sort of about next time you prescribe these.
I remember when I was in Toronto before the pandemic, we used to have a pharmacy come in and sit with the prescribers and discuss the medication and decide whether it needs to come or go or whatever. And that was very helpful. But after pandemic, nothing went back to the same as it was. And I'm in a different home now, and I don't even know who their provider is. There's no communication. And so I'm thinking that the next meeting of residents, I'm going to bring up
yeah, I don't feel like going anyway.
Okay, Les. I would I lost my train of thought. Sorry. I'm going to bring the topic up at a residents' council, and I'm going to lead a discussion about how important it is for residents to know exactly what they're taking and why.
Yeah, that's a great idea.
Here, over here, what they do is every 2 months, they take you into a room, and they have one of your family members there too, and they go through all the media, all the stuff that you're on, and everything else. And it works out pretty good because they go through all the pills and everything with my family member, and then they know, they get a list and they know what I take. So it's pretty good that way.
Yeah, that's a really good idea. I've never had that option.
Oh, you should have that. You should have that
I guess
option.
I'm gonna go
It's
ask
very
for it
important
now.
that you do. I just had one there 2 weeks ago, and they went through everything, got me help, took care of me totally. And
Well,
that's
that's
something that you should get, Devorah.
great. Yeah.
It's very important.
Yeah, I'm definitely going to bring it up at council and take it from there.
Mhm. And Devorah, you could even consider sharing
Yeah,
the
that's
video
good.
during a resident council meeting. That will
The
help you
recording.
explain. Yes, all of that. Yeah,
I was thinking of that. I was to play the recording, and so people will see exactly what I'm talking about,
exactly.
and
Yeah.
you were talking about. Yeah.
I'm happy to email you the link directly, Devorah.
Okay. Thank you.
So I know that there is a resource that goes into a bit more detail, but what does happen when a medication error does occur in the home? Does the nurse or the staff in charge report the errors somewhere centralized, or is there kind of a consistent practice that happens? Just so residents know that these things are taken very seriously. Sorry, Les.
What they do here is they usually line it up and figure out what went wrong, and they get it straightened out, and then they get you back on a pill that you're supposed to be on, and that's what they do with it. So
I know now in the legislation for long-term care homes, there's a requirement that every home has a quality improvement committee, and there is a representative from a resident representative on that committee. And I know on a regular basis, the home does kind of evaluate the medication errors that have taken place. I know sometimes there's confidential details that would be removed in terms of identifiers, but they are tracking, like they do take these things very seriously, and there are protocols to make sure it doesn't happen again. I think that's where you're getting at, Les, is they would want to identify the problem, make sure that the resident who maybe received something wrong isn't in any kind of harm or risk, manage that, but also put systems like to see if there was what contributed to the mistake and put safeguards in place moving forward. So maybe, I'm not sure if any of our guests could speak to that in a little bit more detail.
Well, I would jump in, and then I invite everyone to jump in on this. It's such an important question. Are medication incidents being reported, being talked about at your home? Are they yes or no? And it's a fair question to ask. One of the big things to consider is there a culture where the management wants to see, wants to encourage, wants to make sure that staff and residents and family all feel safe? They all feel safe. We call that a just culture when we talk about that. So if you ever hear or see the term, and we use it in some of our materials, this just culture is where the management has clearly said we want to get this information. We do know, we've had homes that have actually, Shepherd Lodge for one, where they surveyed the staff, and the staff told them on an anonymous survey, not all staff feel safe reporting. So, the just culture is a very important discussion, because if you don't have a just culture and you go to your committee meeting and they tell you there's no medication incident reports, what does that mean? And so it's so important to ask some of these questions. How do you feel when you raise issues? Are they welcomed or not? This is a very important part of medication safety. So each home has its own culture, has its own kind of approach, but there is a requirement to have some kind of reporting system, and then to track how many are happening. Melissa, to answer your question.
Thank you so much.
And so just to add, the purpose of reporting is not to blame anybody. It is to learn from it so that we can learn why it happened, how it happened, so that the same incident won't happen again.
So when I started nursing many, many years ago, if you had a mistake and if it was very serious, you were fired. There was no talking about it. And you know what they found out? That doesn't work. You simply put another nurse in and the same circumstances set up, and at some point there's going to be another similar error. And so this, what Christina's talking about is so important, is we know now that we need to look at why it happened around that nurse or prescriber or pharmacist, what was going on around that. And that's where we come in with the great people that are on the call today, is collaborating with residents, with the prescribers like Mike and Alice and Christina and Melissa. We're going to work together to know how best to make it easy to do the right thing with medications for everyone. That's one of the big things ISMP Canada does, for sure.
Yeah.
Our group is, our Q&A box has been relatively quiet today, which and I did want to mention that we didn't ask too many real questions when people registered, but we did want to gauge from those who signed up to join our webinar today, what were residents or are residents actively involved in medication safety initiatives in your home? And most did say no. And a few instances, family members were known to be part of quality improvement in this area, and a few people said they didn't know. So we hope that this conversation today can be a launching pad to continue the conversation beyond Patient Safety Week, although that's a great time to kind of start. But to build those relationships, to encourage that transparent sharing, and to really demystify these things, so that so when there are challenges, people kind of know, okay, I know I can raise this concern, I can expect action to be taken. There won't be negative repercussions for me or for the team member, because I think we did hear that loud and clear, that people are afraid, or they just don't know what the process is. So learning about the process and what the expectations are, what safety mechanisms are in place is important and empowering for everyone. And I think it's residents are often kind of left out of the discussion loop, and it's often coming from a place of a well-intended place of wanting to protect and not wanting to scare residents, but I find myself saying this all the time, that residents want to be part of the solution. They want to be part of quality improvement, proactive planning, and problem solving. And often residents bring perspectives and ideas to the table that others on the interdisciplinary team maybe hadn't considered. So I think, Les, I heard that really from you, that you really found your experience being involved in this committee rewarding. It was an opportunity for you to build relationships with some of the clinical staff in your home that maybe you didn't have too much interaction with, but they really valued your opinion.
Yep.
They really felt you were an invaluable part of the committee. So this has been such an excellent hour. It truly has flown by. I wanted to extend special thanks to our panel of guests today, and just to assure you that we will be sharing all the links and resources that were mentioned today. And we encourage you, if you have any follow-up questions for our presenters or ideas for future webinars, to include that in your evaluation, so we can act upon those and get some answers for you. And thank you so much. And wishing everyone a lovely afternoon, rest of your afternoon. And thank you, Les and Devora. Your voice has really helped to enrich this conversation. So
thank you, Melissa.
No problem.
Thank you, everyone.
Thank you.
Yes,
Great.
thank you so much for having.
On behalf
I
of all
appreciate
the
this.
residents,
I always
you all for
thank
your
you.
great help.
I
Go ahead.
thank you so much for having us.
Yeah.
For sure, for sure. And we love to be working with you, and we continue that journey. We're on this journey together.
Great.
Yeah.
All right.
Thank
Take
you.
care,
Thanks for seeing
everyone.
the value and sharing this
Take
this message
care.
with residents. Take care, everyone. Thanks again.
Bye-bye.
Thank you. Bye-bye.
Bye.